Morning, Jason.
Morning.
I've just got a few questions, if you don't mind, to answer for us today for the network we could put out. Now, I know also you've been doing a lot of media coverage in terms of television, BBC, radio, etc., off the ball.
Indeed.
So I dare
Who
say,
knew my life would become so
say
strange?
A CPS visit on a Monday morning is right up there for you.
It is right up there. I tell you why it's right up there.
Yep.
And this sounds like nonsense and a bit of a cliche, but honestly, there are some building blocks in this health service that, particularly just now, we cannot do without. So the obvious ones are intensive care and A&E and NHS 24. If they fall over, this is going to be really, really challenging. Honestly, and I'm not just saying this because I'm in your nice building and chatting to you, community pharmacy is one of those building blocks. I don't like a hierarchy of the health service. Everybody's given their all to this mission and effort. But community pharmacy is literally at the front line.
Yeah.
Whether you own 20 pharmacies or whether you're the pharmacy assistant in Elgin, I need you to step up and I need you to keep stepping up because we're not messing around here. This is going to be a long, long effort. And it's to literally save lives.
Yeah.
Now, I know pharmacists and pharmacy communities have that in their heads anyway every day because they're dealing with the diabetic in the community and those with mental illness and all of that. But this is a level of difference.
Yeah.
And I need community pharmacy to really play their big part in that.
No, that's great, Jason. And therefore, how do we make sure we keep our workforce at the work? Is there any advice you could give us around that type of thing?
So I think there's a number of challenges, particularly for frontline health workers. So we have to obey the basic rules. Now, actually, community pharmacies understand cross-infection. They understand distancing.
Yeah.
You guys have been at that game for a long, long time.
Yeah.
And so the social distancing in some environments might need a bit of effort. In some places that will happen just because of the way it's designed.
Yeah.
It's tricky for small places, easier for big ones. The workforce is also really challenging. I think you and lots of others might have to rethink the way we do that within safe limits. So it may be that an at-risk person, somebody in a higher risk band, could still be at work or still giving advice from home, but it may be that they're not the patient-facing element.
Sure.
So you're going to have to be slightly more agile, maybe, than would be entirely comfortable for every pharmacist in the country. So I still want the advice to be safe, well done, with the regulated professionals doing the regulated professional things.
Yeah.
But I think we should think about everybody working to the top of their license. So what do you actually have to do? Is there somebody who's maybe a lower risk, who could do slightly more? And we're going to have to think a little bit differently. Maybe that's about video conferencing, maybe that's about being in groups electronically a little bit more often than we've done in the past. And I know that's asking a lot, particularly of a profession that is at its heart is about patient safety. And that's why I've loved community pharmacy and the safety work we've done up to this point. It's really important. But I think we just have to we don't have to break the regulation, but we have to just think about what that allows us to do in a slightly different way.
Okay. And could you give us just a wee word or steer about pregnant people in the workplace?
So the pregnancy advice is really difficult. The reason it's difficult is this virus has only been around for 4 months.
Yeah.
So if you caught this virus in Wuhan when you were 3 months pregnant, you haven't had your baby yet. So the pregnancy advice is therefore very conservative, deliberately, because we just don't know.
Okay.
It appears that what we know about coronaviruses and other viruses is that in the first 2 trimesters, your risk is almost certainly the same as the rest of the population. The extra risk, as with most disease, happens in the last trimester.
Yeah.
So the Royal College of Obstetricians put out some guidance at the weekend, which I think is pretty helpful. It's a bit dense, it's a kind of big document, but we've tried to summarise it a little bit online, and there'll be some work, there'll be some infographics and stuff later today that will help a little bit.
Okay.
For those of watching later, this is Monday. Every day it seems to change, so this is Monday.
Yeah.
So so our advice is going to be that everybody should be socially distancing, whichever group you're in. So everybody has to take that seriously.
Yeah.
If you can work from home, work from home.
Yep.
If you have to come to work because you're a critical worker, many of whom the pharmacies are, then you have to come to work. If you're in the 3rd trimester, you should really take that social distancing very seriously. So we should treat that group specially. Okay. We should treat that group like the over 70s and those with pre-existing conditions. If you're in the first and second trimester, you still have to take it seriously, but not quite as seriously as that other group. So I think pharmacists are capable of making those common sense judgments themselves. Yeah. But that I understand that that's not straightforward. Yeah. It is unusual for individuals to have to make those choices. Yeah. So that's the advice. You should work at home if you can. You should all socially distance, and the extra risk, along with those with COPD or those with pre-existing immunosuppressant things, the risk is higher in the third trimester. That's the best I can do for you.
No, that's great. That's great. I think it's useful for people to hear that there are difficult decisions to be made, and we're encouraging them to do that, Jason. So that's
and I think a lot of them have to be made. We can give the guidance. I just did a Q&A with the First Minister and some young people, and a lot of the questions are: I'm 17, my mum is this, I've got a granny here, a cousin there. I usually go to my dad's house at the weekend because my mum and dad are sick. These individual stories. It's really hard to give overall guidance for local context. Yes. So I think we've got to trust the local decision makers. So if you're in Barra or you're in Caithness, your response to that guidance is maybe going to look a bit different than if you're in Princess Street.
Yeah. No, great. So just really one last point for you, Jason, if you could. I know certainly a lot of my colleagues at the minute are feeling a bit done to, would I say, by the public and how much work they're taking on, and they're taking, maybe even go as far as saying, a bit of abuse. Are there any words you could say or comfort to the network around that?
So this is so difficult, isn't it? Everybody's scared. Yeah. Everybody's fearful, and we're trying to strike a balance between making the public do stuff and not frightening the horses too much, because we need people not to gather in the parks with beer and 15 people at the weekend. Yeah. But equally, we don't want panic. The panic buying is preposterous and unnecessary, as is panic prescriptions. Yeah. It is unnecessary. Yeah. Everybody tells me the supply chain is robust, the supply chain is good. There are, of course, weaknesses in that, and nobody knows that better than community pharmacy. So I am doing all I can in all my appearances and with the ministers, the Cabinet Secretary, the First Minister, to try and get the public to understand that. The health service is crucial in this next few months, even more crucial than usual, and community pharmacy at the front of that. So I can promise your members, your friends, your whole network that I will continue to do that, and that you should not have to take abuse. We should also, of course, understand that the public is scared. Yeah. And community pharmacy, I think, has a role in calming the public and helping our young people, our more vulnerable community, to understand what they can do and how they can help themselves. And I'll do what I can, and I think your members have to do what they can.
So Jason, the First Minister announced this afternoon, if I'm right, about community primary care hubs. Can you tell us a bit more about that?
So I honestly think, and people say I exaggerate a little bit in my life, but I honestly think these are game changing. We've had to very quickly redesign the health service. Literally redesign the health service, from intensive care all the way down. So the theory here is to take pressure off the broader primary care network, so off GPs, community pharmacists, everybody who's getting this onslaught, particularly of coronavirus symptoms, and those who are scared of coronavirus. Yes. So the idea here is that we will no longer ask anybody with symptoms to contact anybody except these hubs. And these hubs will be directly through 111, and they will be directed to local hubs run by the health boards. Each health board will have one at least, probably more, so Highland will need different ones. Yes. They will be virtual, their first contact will be virtual, phone or video conference. And then there will be assessment centres. They won't all be ready immediately, but then there will be assessment centres physically located where people will then go to be assessed physically, tested, and routed to hospital, home, whatever is required. So it doesn't remove primary care from the equation, but the theory is, and we'll have to run it for a few days, the theory is it should take the pressure off the really difficult hotspots in primary care, including community pharmacy. Yeah. So community pharmacy, from later today, when we start to launch these things, will start to hopefully feel a little bit different. Now, that doesn't mean community pharmacy get to go home. It means community pharmacy has to also change the way it works. So that's why we're trying to take the pressure off other bits of the puzzle. So the minor ailment service becomes a crucial part of that delivery. because GP practices some of them are going to have to staff these community hubs.
Yes.
So we haven't got new people. We haven't created a whole lot of new people. So we're going to have to move people around. And that means community pharmacy has to step up, do things slightly differently, maybe do a little bit more, but we're hoping that the coronavirus pressure will be taken off the community pharmacists as much as we can. Now, not everybody will understand that on day one or even on day 6.
Yeah.
So there'll still be some, but we're hoping that over time that pressure will release and allow the community pharmacists to help us take pressure off the service in different ways.
So the expansion that we are announcing today, you see is fitting into that bigger picture for
not only fitting in, crucial to that overall redesign. It's also interesting to take a slightly longer view of this crisis, that some things are going to change in the health service that we won't change back.
Yes.
So some things are good for the health service, and I think this is one of the things. I think the increased use of community pharmacy to do what community pharmacy does best is surely a good outcome.
Yeah.
And that might be more video conferencing, it might be more telephone triage, it might all of these things. Yeah. And minor ailments is an example of that, as is more GP virtual appointments, so all of those things. So I think some good will come from this when we're out. It feels like a bit of a long haul for some of your guys and for us, but I think out the other end of this, community pharmacy will look a bit different, and I think it might be for the better.
Okay, Jason, thanks for your clarification.